Hi, I'm Alice Lorch. I'm the Associate Chief Medical Officer and VP for Medical Affairs at Mass General. I am here today with Ramin Khorasani, who is the Quality Vice Chair for Radiology at MGB, as well as Jad Husseini, who is our Service Chief for MRI at MGH. And we are here today to talk about our MGB Expedited Outpatient MRI order for admitted patients. So I'm going to start with you, Ramin. Thanks for joining us. Can you tell us about what the problem that we are trying to address is with this new process?
I'd be happy to. Thanks for the invitation. As most of you know, there is a significant challenge around length of stay across MGB institutions, particularly at the AMCs. And there are many work streams, groups working on various interventions to see what factors could be addressed to potentially improve the length of stay. One of the initiatives that has become an important topic for all of us is the use of inpatient MRI. At times, because we have limited inpatient MRI access and much broader outpatient access, we're identifying cases where a patient who would otherwise be best served in receiving that MRI as an outpatient is getting an inpatient MRI unnecessarily. As you all know, appropriateness of an exam is one about the indication for the exam, but also the setting in which the exam is being performed. If we're keeping a patient like that in the hospital to wait for an MRI that could be done as an outpatient, one, that patient is staying longer. Second, that MRI capacity that's so important for other inpatients is not immediately accessible. So what we've done from a quality perspective is to work with our operational colleagues to create strategies to enable this outpatient MRIs to be performed in an expedited fashion to, one, provide capacity when we need it for inpatients, and two, not keep patients in the hospital unnecessarily.
Great, thank you. Jad, can you tell us a little bit more about the solution that MGB is putting in place?
Sure. Thanks, Alice. So we've been working with the offices of the COO and CMO, and what we've done is we've developed and distributed a tip sheet. The idea of this tip sheet is it's going to provide instructions for both inpatient and ED providers for how to order an expedited outpatient MRI for patients who are still in the inpatient or ED setting. The tip sheet includes both how to place the order in Epic. It also includes the contact information for members of our MRI operations teams at both AMCs, and those operations teams members can help schedule the exam. The idea here is that the patient will be discharged with a time and a place for an expedited outpatient MRI. The instructions also include directions for how to CC a designated provider in the outpatient setting for the results. The radiology department on its end will prioritize the interpretation of these exams once they're completed, and will alert the responding clinicians using the clinically significant results system that we already have in place. Should mention that the link, there will be a link to this tip sheet included in this email.
Great. Well, thank you so much to both of you for joining and for all of your work on this exciting initiative. I think this is clearly going to really impact and improve the way that we can take care of our inpatients and improve our workflows. So thank you for joining.
Thank you.
Thanks.